Hi, I'm Dr. Tracey Reed, a psychiatrist, and I make videos on mental health education and self-improvement. Today, I'm talking about psychotic depression, and this is based on a couple of viewer questions. Major depression is an illness where you can have a depressed mood or an irritable mood, and a number of other symptoms that affect your sleep, your appetite, energy level, outlook on life, and so on. You can be mildly to moderately to severely depressed. We usually look at the level of functioning to estimate the severity of the depression. How are you functioning in your personal, your work, and your school life? Someone who is mildly depressed may have trouble getting out of bed and having a hard time finding joy in things, but they still go to work every day and take care of things in the home. The severely depressed person, though, may not be able to get out of bed, despite the fact that there's babies in the house crying for food. Even having people or finances depending on you isn't enough to get you going. Why? Because it's simply not a choice. When depression hits that hard, it takes over your will. Some people will feel like their limbs are too heavy to lift, and we call this leaden paralysis. It's not a real paralysis, it's a figurative term. Depression can also become so severe that you lose touch with reality and develop psychotic symptoms. These psychotic symptoms are delusions and hallucinations. However, delusions tend to be more common than the hallucinations. The delusions can take on a persecutory or nihilistic tone. Persecutory is when you feel attacked in some way. You may feel like people are talking about you or trying to harm you, and on several occasions, I've seen people who were delusionally depressed and felt that people were coming into their home. The evidence for this was that they would see things in the house in different places. So if a glass was moved from one table to the next, it meant that people were coming into the house when no one was there. Another common persecutory delusion that I've seen is feeling as though you're being followed, and each time I've heard this, the person would give me examples of how they would see certain cars driving at the same time each day, or the blue car that was parked down the street for several days in a row. Now, the cars driving at the same time just could be people going to work or going to appointments at certain times each day, or you could have someone visiting and leaving their car parked on the street during their visit. Even though those are very possible explanations, to the delusional person it's evidence of some bigger sinister plot. Nihilistic delusions are when you feel that things are senseless and they've lost their value, like what's the point in life, nothing matters. This can be some of the thought behind a person not wanting to live and making a suicide attempt. Sometimes suicide attempts are impulsive, but sometimes they're born out of these nihilistic delusions that nothing matters, so why does even anyone exist? Even existence is senseless. Keep in mind, delusions are fixed false beliefs. For the delusional person, it's their truth, it's not just an opinion. It's fact that they think everyone should believe, and they don't change just because they hear a good argument against the belief. It's fixed, and no evidence to the contrary will make them believe differently. The delusions can resolve, though, eventually as the depression improves or with a medication intervention. This is different from the psychosis that you would see with schizophrenia. With schizophrenia, the delusions are not only present in the context of depression or even mania for that matter. I did a video explaining schizophrenia in more detail. People with bipolar disorder who become manic can also become delusional as part of the mania, but in this case, the delusions tend to be more grandiose in nature. They can be persecutory, but they still have this grand theme to it. So, for example, you can feel that people are following you because it's just become apparent that you're related to the royal family. Or you can believe that the government is involved in a plot, but it's to use the internet to wipe out society, and thereafter, because you've found a way to thwart their plans. You see the difference. With the depressed person, behind their thoughts is sadness, hopelessness, or fearfulness of being harmed. With the manic delusional person, there's this theme of power and purpose, and you're at the center of it. One other point about the delusions in the context of depression and mania. The delusions tend to be non-bizarre, meaning that they're plausible. They're not likely, but they're technically possible. It's possible that someone is letting themselves into your home when you're away and changing the position of your beverage glasses to send you the message that you're unsafe. But people probably are not spending their time doing that. Whereas the delusions that we see with schizophrenia tend to be more bizarre in nature and implausible. An example of this is believing that some entity is removing your organs at night while you sleep and using them to sell overseas. Why is this implausible? Because we can't live without our organs. That may seem obvious, but if you say this to the psychotic person, they may say, well, that's the whole secret. We're all living without organs or without some of your organs, and you don't just realize it because they're being taken out little by little. The delusions can get very convoluted. One of the difficulties with recognizing a psychotic depression is that the thoughts can be such a part of how you feel that you don't realize that your thinking is off. If you're feeling very depressed and worthless, it doesn't occur to you to raise your hand and say, "My thinking has gotten so extreme that I think people are trying to harm me." It just seems like a natural progression of how you feel. Even people close to you may not recognize the degree to which your thinking has morphed into delusions. A psychotic depression can happen at any age, but the incidence of it tends to increase as people get older, like 60 and beyond. How do we treat psychotic depression? Psychotic depression that occurs within unipolar depression would be treated either with antidepressants plus an antipsychotic medication or electroconvulsive therapy. Antidepressants would be medications like fluoxetine, escitalopram, and venlafaxine. Antipsychotic medication examples are quetiapine and aripiprazole. If you go the medication route, there's not a set amount of time that you need to stay on the antipsychotic medication. You do need to stay on it long enough to make sure that the psychotic symptoms are not going to return. This usually means several months, probably around 3 to 4 months, and at that time, it's reasonable to taper off the antipsychotic medications. But stay on the antidepressant for a total of about 6 months to a year. Anything less than 6 months, and you're at risk of having a return of your depressive symptoms, so you never want to start a medication. Feel better in a month or 2. And then stop the medication because you feel better. It takes the brain about 6 to 9 months to recover from a depressive episode, so I tend to keep people on the antidepressant medication for 9 months to a year. Then at that year mark, if all is well and things have been stable, I'll taper them off of the antidepressant and see what happens. If they have a return in symptoms, I'll restart the antidepressant and get them back up to the previous dose that worked, then stay there and try again another time, maybe in 6 months to a year. I would not restart the antipsychotic medication unless the person had a return of the psychotic symptoms as well. Psychosis that occurs inside of bipolar disorder, whether it's the depressive phase or the manic phase, is treated a little differently because you have to be careful about adding an antidepressant to someone with bipolar disorder. Antidepressants increase the risk of triggering a manic episode or making someone rapid cycle between phases. I talk about using antidepressants in bipolar disorder in this video. So for the person who has bipolar disorder and becomes psychotic, you could use electroconvulsive therapy, the same as you would for psychotic unipolar depression. For the medication option, you would add an antipsychotic medication if the person is on nothing. But if the person is already on a mood stabilizer, you could still add an antipsychotic medication to their current regimen. So for example, if the person was taking lamotrigine as a mood stabilizer, you could add quetiapine to the lamotrigine. If the person was already taking quetiapine and still became psychotic, you could increase the quetiapine or add a second antipsychotic medication for a temporary period of time to bring the psychotic symptoms under control. I only mention quetiapine as one example of an antipsychotic medication that's commonly used in bipolar disorder for mood stabilization. But since it is an antipsychotic medication, it also treats the psychosis if it's present. That's psychotic depression. Thanks for listening. See you next time.